Dr. Nicholas Mercer with you, Improve PT. In this video, I'm going to give you some guidance on when you should be seeking surgery as a treatment for hip impingement and labral tears. Most people who are diagnosed with hip impingement, also known as femoral acetabular impingement, and a lot of times that also results in hip labral tears. One thing that they're all worried about is, will I need surgery? Will you need surgery? Because we all want to avoid surgery as much as possible. Now, obviously, sometimes you get surgery and it's not necessary. Sometimes you get surgery and it was necessary, but it's hard to tell the difference between those two once you've already had surgery. So what we want to really focus on is delaying surgery or avoiding surgery as much as possible, right? Because when you go through surgery, you get irreversible changes in those tissues. So we want to do as much conservatively to improve the movement of your hips and the quality and health of those tissues in order to avoid the need for surgery. So there was a systematic review and meta-analysis of 3 randomized controlled trials. So just to give you an idea, systematic review and meta-analyses are kind of the top tier of evidence in research, and randomized controlled trials are just below that. So they took 3 of those randomized controlled trials and did a systematic review meta-analysis. They basically took all the data from those 3 studies and compiled them into a review. So what they found, what they were looking at was the results from physical therapy as a treatment for hip impingement, FAI, and labral tears versus surgical intervention for hip impingement, FAI, labral tears. So what they found was in patients who had surgery, they had actually better results than people who just went through physical therapy alone. Now, you can look at that and assume that everyone who has hip impingement, FAI, and labral tears is going to need surgery. However, if we look deeper into the research that they looked at, and even some considerations as to some limitations in the research, we can see why that may not always be the best option. So number one, for people who ended up getting the surgery, a lot of them had failed conventional conservative physical therapy treatment. And that basically what that means, they went through physical therapy and they weren't getting the results that they wanted, and then they did surgery and they got the outcome that they wanted, that they were looking for. However, there were a significant amount of people in the physical therapy group, in the conservative treatment group, that did find the results that they were looking for, and therefore they did not need surgery, and they did not need someone going into their hips, slicing them open, and basically completely reworking how their hip functions. So obviously that's the ideal situation. Now, that may not work for everyone, but we also have to look at the actual physical therapy treatment. Now, in 2 of these studies, I would say that the frequency of physical therapy treatment was way lower than it needed to be. In one of these studies, they only did 8 sessions of physical therapy in 20 weeks. And if my past patients are anything to go by, they were not doing their home exercise program every day. So obviously, just in 8 sessions of physical therapy over 20 weeks, that's basically less than 1 treatment per 2 weeks. I would also not expect such great results from that. So the fact that some people in that study did find significant changes with physical therapy, like, how much better would they have been? How many more patients would have been able to avoid surgery if the frequency of that physical therapy was more? If they had more physical therapy and they were taught to manage all of, they were taught all the exercises, the stretches, the mobilizations, the activation exercises for them to do on their own at home. Another study, the second study, they only had them doing 6 to 10 sessions of physical therapy over 12 to 24 weeks. So kind of a similar ratio of frequency, right? Kind of 1 treatment every 2 weeks, probably less than every 2 weeks. So similar thing here, if we're not getting that frequency managing those hips, we may as well be starting from square one at every single treatment. you're not going to get the improvements that you want to see because it's not frequent enough. All of the things that you do throughout your day that cause the hip to pinch more, that's several hours every day, and you're taking maybe 1 hour every 2 weeks to try to reverse all of that. So you can kind of start to see where some of the flaws in the physical therapy treatment in these studies would be. And also, again, the fact that some of these patients were able to avoid surgery with just that few amount of physical therapy, like that little physical therapy, goes to show you like how much better it could have been if they did more physical therapy. Now the last study, they actually had a better frequency. That was 12 sessions over 6 weeks, which is what we would typically see in an insurance-based clinic. But I would even say doing, let's say each session of those is a typical 45 minutes to an hour, which is what you'll get at an insurance-based clinic. Even that 2 hours per week, I would say isn't enough initially to reverse the effects of those symptoms, the FAI hip impingement symptoms. And so kind of what we see with these studies is even with the very little amount of physical therapy that these patients were getting, some of them were able to avoid surgery. I would love to see a study that really takes physical therapy, specializes it to each person, and finds their deficits and then works on them pretty much daily, at least initially daily, and then over time have those patients incorporate those techniques into their everyday life to manage these symptoms, because this isn't something that you necessarily are going to fix and then it's gone, right? It's something that we manage, and very effectively actually. A lot of patients with hip impingement are able to manage their symptoms so that they never need surgery. And they move and they do basically every activity that they want to because they restore the health and the proper movement in their hips. And then we get to not all PT is made the same. So some of these studies had the same PT for all the patients, and some of them had different PTs. And PTs treat a lot of different conditions very differently. A lot of PTs don't really specialize in one thing like hip impingement, or they don't have a history of treating a lot of patients with hip impingement, or they haven't had hip impingement themselves. They haven't experienced it firsthand, what goes into the sensation, the compensations in the hips, and everything that happens when you have hip impingement and labral tears. Now, someone like me, I've had some pretty good success with my patients who do have hip impingement because I've been there. I've even had the surgeries, and the surgeries made my hips worse. Even the x-rays and MRIs after I had the surgery, two orthopedic surgeons told me I needed surgery again because I had still FAI, the extra bone on my hips, and labral tears. I didn't have another surgery, so I still have that going on in my hips and I don't get any symptoms. So that's anecdotal, but the fact that we see patients that are able to make everything function well enough to avoid surgery, that's really the goal here, is to manage those symptoms over your life, right? And overall make you a healthier human being. And again, a lot of these people who go through surgery, they do end up either, some of them are unsatisfied with the surgery, and even the ones who are very satisfied, they need to maintain all of that with physical therapy and different stretches and strengthening exercises in order to maintain the health of their hips and to avoid further surgery and potentially, for some people, not everyone, for some people, a progression to arthritis. Now, the research on that is a little all over the place, but we'll get to that in another video. So my answer to this, and my answer to the variety of physical therapy, the different physical therapists who frankly don't know how to treat an FAI or labral tear hip, or the entire person who's experiencing hip impingement, the lifestyle changes and the different movements of the hip, and really getting down to where their deficits are, they don't really know how to treat that. Now, what I have done, and I am working on now, and it will be coming out soon, I'm putting together a program with 15 tests, right? So these tests will help you narrow down the deficits in your hips, the deficits that are probably causing your hip to impinge, get those symptoms, right? Whether or not you actually have an anatomical abnormality inside of the hips. These tests have been used by me in the clinic to identify deficits so that we can focus exercises, either strengthening, stretching, mobility exercises, soft tissue mobilization, in order to decrease those deficits and get the hip working like a hip again. This program will help with those tests guide you towards the specific exercises that are most likely to help you. Now, this is coming from someone who has 8 or 9 years of not only discovering what works for me personally, but also what works for other patients with hip impingement, with other people going through this hip impingement FAI labral tear pain. And I've taken all of that with my doctorate of physical therapy degree and have compiled it into 15 tests that people can do on their own, which will then direct them to the exercises, the techniques that are going to help them manage their hip impingement, decrease their pain, and improve their movement so that they can go on with their active life. Now, there are several exercises in this program, several techniques, several soft tissue mobilization techniques, and a variety of information to get hip impingement better. And that is my goal with this program, is to allow people to not only find a solution that works for their hips, but also make it time efficient in that we have tests that will help narrow down your deficits. So we're not just testing out a bunch of different exercises, we have some guidance in there. And it's from completely programmed and created by a doctor of physical therapy who knows what you're going through, knows what symptoms you're feeling, and how awesome it feels not to have those symptoms anymore because of exercises and techniques like the ones that are in this program, right? So if you're interested in getting one of these programs or interested in learning more about this program, please go to youimprovept.com, send me an email, give me a call. I would love to talk to you about your problems and what this program would actually entail. If you're not quite ready for that, that's okay. Check out the rest of our YouTube channel, where we have a lot of different videos on improving hip impingement, making those hips healthier, and living an active life so that you don't need to have surgery. Now, if you have questions about the study that I was referencing, I will link a PubMed link below in the description so that you can go to that and read that for yourselves. But just remember, physical therapy first, conservative treatment first, is going to be the best first step. I regret not doing physical therapy before getting surgery. The surgeon told me I needed surgery. I got surgery. I firmly believe I would have been able to avoid surgery if I had gone a conservative route prior to that, because going a conservative route after surgery, where my hips were made worse, my symptoms were worse after the surgery, and my hips looked exactly the same according to 2 orthopedic surgeons, remember, and that conservative treatment is what ultimately made the most difference in my hips, right? So just remember, surgery is a last resort. Don't worry about surgery right now if you're just starting your hip impingement journey. Focus on being consistent with physical therapy, conservative treatment, and trying your hardest to improve your hips and improve their movement. And if surgery ends up being the thing that you need, then it does. Your hips may just be that bad. But for a lot of people, PT, conservative therapy, can really, really help you avoid surgery. So go to youimprovept.com, get in contact with us, and check out the other videos on hip impingement on our YouTube channel, and get ready to improve your pain, improve your movement, and improve your life.